Welcome to the Neuroblastoma Parent Global Symposium. My name is Jelena Magic. I'm a neuroblastoma mom from Melbourne, Australia. My 3-year-old has recently completed frontline therapy for high-risk neuroblastoma, and I'll be moderating this session for you. Our topic today is coping as a family and accessing support services. The session is being delivered by Dr. Christina Signorelli, who is a postdoctoral research fellow at Kids Cancer Centre, Sydney Children's Hospital. Before I hand over to Dr. Signorelli, I'd like to draw your attention to the Q&A button at the bottom of the screen. You can use this button to submit your questions during the session for the speaker. However, all questions will be addressed at the end of the session. If the button is not showing, just tap or hover your cursor to bring it up. If you see a question that you like, give it a thumbs up and that will move it up the list. Thank you, and over to you, Dr. Signorelli.
Thanks so much, Jelena. I will just share my slides with you all. Wonderful. Great. So thank you all for joining, and I'm really pleased to be able to talk to you today to give you an overview about some of the challenges that families can face after a neuroblastoma diagnosis, as well as some practical advice on coping as a family and how to access these support services. As Jelena mentioned, I'm a research fellow at the Kids Cancer Centre at Sydney Children's Hospital in Australia, and so I'll be sharing with you a little bit of insight into, I guess, what we know about the impact of cancer and why this matters, but also sharing some of the research that I've done with my team at the Behavioural Sciences Unit at the Kids Cancer Centre, describing some of these experiences and advice from parents themselves. And finally, I'll touch on some of the support that's available, the types, how to access it and why it's important. Most of my talk will be Australian-centric, given my location, but hopefully it will be broadly applicable to you all. So I just wanted to start my my talk by, I guess, with the concept that childhood cancer is a marathon, not a sprint. And in these early stages at diagnosis and in early treatment, life is completely interrupted. It can come to a crashing halt, and it's often a time of acute distress and for families at a time of high need for psychosocial support. After a lengthy treatment period, at the end of treatment, there's often a mix of emotions for families. There may be a sense of relief and excitement at finishing treatment, but unfortunately, this is also coupled quite often with feelings of ambiguity and uncertainty as to what's to come afterwards. Perhaps a sense of desertion after quite a lot of involvement and attention from the healthcare team and their treating team to, I guess, a stark contrast with much less contact in this post-treatment phase. And for some, there's even a sense of grief or sadness, perhaps about the things that they missed out on during their period of treatment, particularly if they spent lengthy periods of time in hospital or away from home during treatment. Thankfully today, many families or patients will progress into survivorship, and this time is really characterized by reintegration and adjustment, finding that new normal after treatment. And although they're deemed cancer-free, they still might be known as the one with cancer. Again, there's a sense of what the patients missed out on during this time. And they might have a sense of feeling left out of certain things, perhaps reintegrating back into school or going back to daily life and trying to find that new normal again. So for some, the way of coping is through avoidance or withdrawal, and it can leave many feeling fragile and drained after a lengthy period of ups and downs, if you like. And during this period, it's also worth noting that a lot of late effects can emerge as well. And although usually physical in nature, they can often be psychological reminders of their cancer experience. And although this won't be the focus of my talk today, I also wanted to acknowledge the group for whom, unfortunately, treatment isn't successful. And so they progress into end-of-life or palliative care. And during this time, it's incredibly important for those families to think about finding meaning through their cancer experience, and perhaps they're preparing for grief or experiencing anticipatory grief at the thought of losing their child. Regardless of the stage, each of the periods in the cancer trajectory are incredibly important, and they represent peak times at which families can experience difficulty coping and do have a high need for psychosocial support. So when I'm talking about coping and well-being, there are many domains of well-being which I will touch on today, and I thought were worth illustrating. In particular, the emotional aspects, particularly mental health, social well-being as well, for example, survivors or patients' connectedness to their peer, as well as their extended or their family and extended family. And I'll also talk about physical health as well. And that's not just patients' overall health, but also things like healthy behaviors such as exercise and good diet. So why does all of this matter? Why is it important to have good coping strategies and to promote well-being throughout the cancer experience? Well, recent literature highlights that quality of life during treatment is very much influenced by factors such as parental support, school support, and also strong sibling relationships. And after treatment, patients report factors such as living a life similar to their peers or having a strong and good satisfaction with their life situation as strongly influencing their quality of life during and after cancer treatment. And so thinking about all these domains, there's a number of reasons why it's important to promote positive well-being, to promote facilitating access to the right support services throughout the cancer trajectory. And that might be overall to cope with and accept, say, a diagnosis or the uncertainty following treatment completion that might be prevalent during these periods. It can help patients and survivors and their families to find meaning during these difficult times, to learn to adjust, particularly at each of those peak periods of difficulty, to find new normals throughout each of those phases. It can also help patients and families to gain a sense of control, understanding their situation and moving forward in the best way possible. It might be more practical, for example, how to manage and cope with symptoms like pain, which are incredibly interrelated with psychosocial and emotional well-being. It might be intimacy or relationship concerns, how to manage and cope with those, for example, raising infertility issues with potential partners much earlier than you otherwise would have in a relationship if you didn't have cancer and cancer treatment, which could affect your fertility. And of course, it can support decision-making at various stages, but particularly relating to treatment. And overall, positive coping and good psychosocial well-being can enhance quality of life, maximize survivors' potential after treatment is finished, and improve resilience throughout each of those stages. And I do want to mention that although a lot of my talk today is focusing on those negative outcomes and potential adverse effects, that actually the majority do cope really well, both patients and families. And in fact, many report experiencing post-traumatic growth or post-traumatic benefits as a direct result of their cancer experience. Some describe it as life-changing and having found meaning through their cancer experience. And so many do go on to thrive. And I believe there's another talk in the Symposium on post-traumatic growth specifically. So definitely something to tune into if you're interested. But unfortunately, as I mentioned, as patients move into young adulthood and and later adult years. Late effects, physical late effects, can pop up many years or even decades later, and this can often be a psychological reminder. And so it's really important at any stage to be aware of the appropriate supports that are available to cope with these challenging times. So as I mentioned, I do want to share with you some of the stories and experiences and advice from families who have participated in the research that I've been involved in with my team. And in particular, I'll draw on the results of a study involving patients from all 11 paediatric centres in Australia and New Zealand. And so we were fortunate enough to have over 600 survey responses from these centres, from survivors and parents of young survivors, of which about 8% roughly were neuroblastoma survivors and parents. And about 120 of the survey respondents also completed interviews to give us more in-depth insight into their experiences as well. And the overall aim of this program of work was to understand the impact of cancer, or childhood cancer specifically, in the long term, and to use that information to understand risk factors for poor health and psychological well-being, and to develop a wealth of programs, which I'll touch on later on, to actually address these problems and intervene where appropriate to provide support for families after cancer. So in this study, around 42% said that they experienced anxiety or depression, and 33% specifically said that they experienced emotional late effects relating to their cancer. And the results from our interviews really supported that emotional impact, if you like. So particularly among parents who described distress and anger and other emotional impacts in their child, and the way that they coped with that, either through disassociating or other behaviours, as they grew older and came to terms with some of the side effects or challenges of being a cancer survivor. And as his father highlights, post-treatment, he felt that psychological issues weren't explored very well, and that there was a great need for further support there. In our survey, families also reported a great unmet need for information, and that related to relationship advice, financial, educational, or employment advice, information on how to manage pain or fatigue, and alarmingly, about 38% said that they needed information still on psychological support. And again, the interview data really echoed these results. And so again, particularly among parents, we found that they described periods of difficulty, particularly impacting adolescence, for example, which we know is a challenging time, even for healthy kids who haven't got a history of cancer. You know, that these social challenges are incredibly difficult through that time, particularly in school and interactions with their peers. Another key finding, I guess, from the interviews that popped up in relation to lack of information was also accepting a degree of uncertainty. So the potential that the cancer or a second cancer may arise to many parents never sort of went away, and they described always being worried and always wondering if you know, a symptom was indicative of another cancer in their child. And this mother says that it's just a wide unknown. As I have alluded to already, the impact wasn't only on patients and parents as well, but on the wider family. So where parents didn't know what type of support was available, they decided that the best thing to do was just to stick together during these difficult times. And they described the impact as being really traumatic on the whole family. As this mother says, they had 2 older daughters who virtually had to grow up very, very quickly, and that was because of all the time that they'd spent in hospital. And diverting away from the usual things that the kids might have been doing. And of course, there's the impact on grandparents too, who are often forgotten, depending on how present they are. They obviously have their own needs and, you know, concerns for their grandchild. And so there's the additional pressure to support them as well as their own family, support grandparents as well as their own children and family as well. In our survey, parents and survivors also reported a lot of unmet support needs. So between 30 and 53% said that they would like access to a social worker or a psychologist. And at the end of the study, we actually asked if they would like us to facilitate access to further emotional follow-up care, and 1 in 10 indicated that they would like us to. And so that's something that we did at the end of the survey, and I think really represents some of the unmet needs of this group. In terms of aspects that parents shared with us that they thought were useful for coping, peer support and communication were really critical, as highlighted by parents. So maintaining constant communication throughout the cancer trajectory and talking to others rather than just keeping it in and thinking that you're the only one in the world that this is happening to, as this mother says. And spending lots of time talking, but also talking to the right people. So this other mother says that she didn't feel comfortable always talking to her sister or her mother, but she had other friends that she could lean on and talk to that could offer support or just even a listening ear. And other families found that it was useful to prioritize. So prioritizing time with family to really focus on healing. Where possible, they left work during these difficult times. And as his father says, you know, they took a really practical approach, making sure that they took care of themselves and eating, because if not, it'll just make it worse if we're not strong enough to be supportive of their child or their whole family unit. So looking more now at the types of supports that are available for families, there's certainly a wealth of different supports, and this does differ across different countries as well. But before I go into those, I just wanted to highlight that really for some time, psychosocial care hasn't been incorporated into the standard of care, cancer care, and it's a relatively recent thing that's gaining a lot of attention and that we're increasingly understanding the importance of. And so a few years ago, standards for the psychosocial care of children with cancer were published. And I won't go through all of these guidelines in detail, but I just wanted to highlight what you might expect from your healthcare providers and from others who you are accessing support from. So firstly, in terms of the frequency of screening, so it's not something that that stops at any point. Right throughout the cancer trajectory, you can expect routine assessments and screening, anticipatory guidance and information, and support on different aspects, right from treatment through to survivorship or bereavement. And the type of information is multifaceted, or the type of support rather is multifaceted. You've seen the domains of well-being, and all of these really reflect those different facets that the guidelines advocate that should be provided. So educational and vocational support, social, emotional, and psychoeducational support, financial support, and everything even up till, you know, risky behaviors and or more procedure-focused things during treatment. And finally, it's not limited to the patient, or care and support is not limited to the patient or survivors, but it should be accessible and is available for long-term survivors, for their siblings, for parents, caregivers, and really anyone who, in my opinion, is important to that patient and their cancer experience, should be accessing this type of care. So these are the type of things you can access, or you should expect to be able to access at any point throughout the cancer trajectory. And of course, different families will have different experiences and different challenges and need help coping in different ways. So in terms of summarizing what that looks like, because the support does come in many shapes and forms, parents will receive handbooks at their child's diagnosis, which is a really helpful list of resources that can be useful for any stage of the cancer trajectory. And so you'll find these and other resources and reliable information to help you throughout these difficult periods. But of course, you can also contact counsellors and the different types of peer support groups and charities and services that are available depending on your needs, either during treatment and in early survivorship or later on as well. And that really isn't, I guess, limited to, I've lost my train of thought, I apologize. I guess as a handy tip to keep moving on, one other thing you could do if you do have insurance is to contact your insurance provider and to see what is covered in your plan, for example, in thinking about some of the more practical ways to access support. But whether it's an oncology professional or an allied health professional, if you've tried to access support and you've had difficulty doing so, your family doctor is always a good place to start, and as are community organisations and charities who can often facilitate pathways to finding the right support that you need. So it's about really understanding what you need and then the different pathways to accessing that type of support. And I also wanted to mention that, as I said, it is relatively recent and up and coming notion to be maximising quality of life and potential in these difficult times, rather than just focusing on survival, which is incredibly important, of course, but so is quality of life during and after survival. And I'm really fortunate to be able to work with a team of wonderful health professionals, clinicians, psychologists, and exercise physiologists, dietitians, and so on to be developing and really leading in Australia the types of or designing and evaluating and implementing new programs to support families right across the cancer experience. So I won't be able to touch on many of these in much detail at all, but really just to highlight that there is increasing awareness, right from treatment and diagnosis through to survivorship and end of life, to support families in promoting quality of life, maximising potential, increasing resilience at different stages, and ultimately trying to address each of the domains of psychosocial well-being to enhance quality of life after cancer and during cancer as well. So some final thoughts and tips to take away from the many supports that are available, but also from the experiences of the families I touched on earlier. Firstly, to seek support early. As with anything, it's always more manageable to and treatable to seek support, even if you're not sure if you need it, or if you're not sure if you're eligible for certain, say, financial schemes and things like that. But definitely to start that process and those conversations early, even if you're not sure if you need them, so that when you do need them, they're there. And if you have found it difficult, or you're time poor, or perhaps you live in a rural or remote area, just an awareness that there's lots of new flexible options, particularly with COVID now, to facilitate support from anywhere. So, even the comfort of your own home, whether it's a mobile or online support group, there's increasing evidence for their efficacy. So you don't have to travel to see specialists if that's something that you find difficult, or if you're simply time poor. Keeping family and friends close, as some parents mentioned, not to suffer alone, but to communicate with others that you feel comfortable with, and to share experiences and advice, and importantly, to help your child stay in touch with their friends and family as well. I think it's really important to allow yourself time to adjust to each new normal. There's lots of ups and downs and different milestones in the cancer trajectory. So, just accepting and acknowledging that there will be difficulties at each of these times, but it's okay to struggle a little bit and to seek the support that you need to find that new normal at each of these periods. And most importantly, to take care of yourselves as parents. To make time for yourself can give you the energy that you need to support your child and your family through these incredibly difficult times, and that includes giving yourself a break as well. So just wanted to acknowledge the funding bodies and those who have made this research that I shared with you earlier possible. And to thank you all for listening. And I'm really open to any questions, but also to you sharing your experiences and coping strategies and supports that you've accessed that you've found useful as well.
Thank you very much, Dr. Signorelli. Cancer diagnosis is certainly devastating for the whole family, and parents, siblings, and patients do require support from a wide range of services, which are often outside of the scope of what oncology departments alone are able to offer. So we very much appreciate this very important sessions. We do have questions here that I will read out to you. So the first question is, what are the thoughts on raising infertility discussions? Is this better to do earlier?
I guess that depends if, I think I mentioned it in my talk in the context of raising infertility with potential partners or in intimate relationships. And yeah, I guess that's a difficult one if that's what you meant. And I think that just depends on whether you know that you're infertile or if it is a confirmed diagnosis. And the reason for that is because there are lots of new treatments available and ways to store so that there are other options for having children later on. So if the question is about raising discussions, raising infertility discussions with your health professionals, then absolutely earlier is better, particularly early, in the treatment period where there might be possible options to address that. And so there are ways of having your own children later down the track.
We also have a few questions relating to psychosocial support. So do you think families' psychosocial support needs are being heard clearly and loudly enough? Is there anything we can do as a parent or patient community to highlight these more and push for the guidelines to be adopted more fully?
Yeah, I think, look, I think that voice always helps coming from the consumer group or from the patient and parent community. I think absolutely, if we can all come together for this common cause, then, I don't think anything more needs to be done. I think there's a great voice there already. And actually in the academic community as well, I know that, it's not just enough to have these guidelines introduced. There's also been pushback since they've been released to have more guidance on actually how to implement these guidelines in practice, because that's the hardest part, is actually creating that change and, fostering that change in a clinical setting. So I think it's always helpful, but I do, to have that patient voice and that consumer voice as well. But I think generally we're doing everything that we can so far, and I guess we're also, on a more positive note, working together with families more closely as researchers and clinicians to really accelerate that voice, if that makes sense. So I think it's maybe almost more what we could do to help communicate that more clearly.
In the same line of thought about practical support, what are your thoughts about the timeliness of information provision and referral processes to psychosocial support? Do you think they're happening as fast as patients and their families would expect?
Yeah, that's a really good point, and I think that depends on the practitioner a little bit as well, and how aware they are of these issues. Often the focus is on medical and physical health, and that's completely understandable. But especially given how interrelated that is to psychological health, we could certainly be doing a lot better. And as I said, it's only a sort of recent recognition of the psychosocial needs of patients and their families. So whilst there are new screening tools being developed, new programs being developed, they really still are in that transition phase of implementation, if you like. And so I absolutely think we could be doing better there, and it could be happening quicker. But the tools are still being developed to recognise that and to effectively screen for these issues in the first place. So there's still a lot of work to be done.
In your study, have families mentioned the impact of any financial burdens on the family units?
Yeah, definitely. Although I must say not so much. It was a huge study. So the survey, I think, was something like 12 pages. But I must say we didn't prioritize the financial impact as much as, say, the physical and emotional impact so much. And that was in the survey. In the interviews, it definitely came up organically. And it's something that can affect, the quality of care that's being provided, from so many aspects. I guess one of the things that was really pertinent was that even though, say, survivorship clinics are freely available and accessible to families, at least in Australia and New Zealand, that there were other financial burdens associated with coming to clinics. So, it meant families would have to take a day off work, perhaps take their child or even siblings out of school, and maybe if they were living rurally or remotely, or even a little bit further out of town, it might mean a night stay at a nearby hotel, and other incidental costs associated with that as well. And that's just a survivorship clinic visit, maybe once a year. So definitely lots of barriers and financial burdens that I think warrant a whole research program itself. And I think it's gaining a lot of interest in the scientific community as well. To be able to quantify that is incredibly difficult, though, but it definitely was something that came up organically.
Yeah, and I can definitely personally relate to that, because we had to raise a huge amount of money through crowdfunding to access this clinical trial disease. And it may sound as an outlier, but I know at least 6 or 7 other families in Australia who had to do the same thing. So I think those things have to be addressed as well. And
definitely
wonderful to see that it's recognized at the top that need is there, and that support is being given to people who
absolutely
need to access clinical trials. Sorry, 1 second. Now there's a question for families in UK. Cliff Sargent offers access to social care support and social workers. Do families in Australia use Red Kite or another similar organization?
Yeah, absolutely. So Red Kite and there are associated charities and organisations like Canteen, which is specific for adolescents and young adults. There are definitely similar community organisations and charities which offer access to support and facilitate access to resources or support programs, or some even have scholarships for school-aged children. So there's definitely similar organisations in Australia, such as Red Kite and Canteen and so on, which offer that kind of support, definitely.
And there's a question. I have read about trauma being caused to young children when their parents hold them down during uncomfortable procedures, for example, needles and other invasive procedures. And this should be done by nurses only. Can you comment on this? Parents cannot imagine leaving their child during these instances.
Yeah, and of course, depending on the procedure, and I'm sure even the hospital, sometimes parents are asked to leave and sometimes they're able to stay with the child. I'm reluctant to comment on, whether it should be done or not, because everyone has different processes and I'm sure different rationale for that. But it certainly is something that that can cause, I guess, long-term impacts psychologically. It might mean a fear of either the same procedure or related procedures. It can certainly create an aversion to seeking healthcare at the right time or at all, whether it's related to their cancer or the procedure that they had a trauma with, or just more broadly. And that's something that we explored more in our interviews as well. Even though children were quite young, when they had these traumatic experiences, it absolutely has a long-term impact, and it's something that stays with kids, right into adulthood, and can have long-lasting impacts. Fortunately, there's a lot of work being done in that space to educate patients, to prepare and educate parents of really young kids to help them, manage kids' anxiety and their own anxiety, which can transfer onto their children. There's a lot of resources being developed to help reduce that anxiety before a procedure, during a procedure, and even afterwards, if there are any negative short-term impacts already being seen. But it can definitely absolutely have long-term lasting impacts. Thankfully there are services like child life therapy who are able to support families more closely, even where the parent can't be in the room with the child during the procedure.
Thank you for that. Now I have a question of my own. We're being actively involved in many support groups, both in Australia and overseas in the US and the UK. I'm under the impression that the vast majority of active members of these support groups are of European origin. And we know that almost a third of Australians, and I imagine it will be similar in the UK as well, are of non-European ancestry. And for many, English is not their first language. So what are your views on this underrepresentation of minority groups in online forums and other support services? Are healthcare and allied services failing to reach them? Or is there some reluctance on their part to use the available services? Or are there some other barriers of access?
Yeah, I must say it's not something that I had been aware of, so I'm really interested to learn of that. I guess it's possible that it could be either of those, just an underrepresentation. I think, cultural factors potentially play a role there. Just thinking about the different cultural aspects which can influence the way people seek care and ask for help, and what they think is appropriate based on their cultural background and so on. So that could definitely be a factor as well. But it's certainly something that's worth investigating more and understanding some of those behaviours, and then developing specific services to target those groups if that's what's what's appropriate, or otherwise just making it more well known and available to those groups.
Thank you very much. So thank you everyone for watching. I think we will wrap it up here. Thank you for your questions. We have reached the end of the session, but please do join us again at 2 p.m. London time for the opening ceremony, which will be followed by a session titled Neuroblastoma Basics, Introduction to Neuroblastoma. Thank you and goodbye.
Thank you all.